a lot of folks will think, well, I can't have a unit-based contract and milestone-based payments. Well, you can. And the thing that typically happens when you use a unit-based contract with unit-based payments is 70% of your budget is going to be based on nothing to do with enrollment. And so you'll end up paying in large part for the patches of time. And a lot of us from the sponsor community, we've been, it seems like a harsh word, but the victims of bad contracts, where we're a year into a contract, we've spent half or 60% or 70% of the budget, and we either have none or just one or two patients enrolled because we rely on paying based on units that are tied to months as opposed to units that are tied to actual progress. So what we like to do, and we like to recommend that our clients do, is it's great to have that unit-based budget so you understand the construct of what makes up your price. But then what we like to do is to take those units of work and to map them into specific milestones related to progress. Now, what a lot of folks will do is, and this is especially true from the CRO community, is they'll use arbitrary numbers and percentages for those milestone-based payments. And when you ask them how those were derived, you usually get kind of a blank stare or a question that talks about cash flow. And so what we like to do is we like to make sure that those milestone payments, whether it be, first patient enrolled, 20, we usually something like first, 25, 50, 75, and 100% of patients enrolled and patients completed, sites activated, pages cleaned, and we'll tie, for instance, sites activated back to the site initiation visits plus some percentage of project management meetings and the rest of the things that we think that are kind of happen pretty much on a constant. Truth of the matter is a lot of those things ramp up pretty quick in the beginning, then they'll drop off a little bit and they'll level out over the course of the study and then ramp up a little bit back at the end. And so you can take one or two approaches with that. Is you can take those time-based elements like project management or meetings, and you can say, I'm going to apportion those as a percentage of the activity that's actually accomplished, or you can just straight line it over the time period that's going to occur. And we'll use a model like that to build our milestone-based payments. Now, why this is important is that you're not paying for time. You're paying for the fact that you have patients enrolled, patients completed, CRFs clean, because at the end of the day, we need one thing from our study. We need clean auditable data that reflects the patient count that was necessary in order to power the study. That is the entire intent and the purpose and goal of any given clinical study. What that data says is another question, but what we need in order to understand what that data says is good, clean, auditable data for the powered number of patients. And so we want to make sure that our payment structure is such that it is incentivizing the provider to reach those milestones in order to get you the data that you need. And another interesting conversation that you can get into when you start talking about milestone-based payments is you always get into this conversation of, we ask for 100% of the budget to be based on milestone payments, and the CROs always come back and say, well, we need to have some time-based payments. And so now you're talking is 25% of the budget based on time and 75% based on milestones, or something in between. And one of the conversations you can have with the provider community is the confidence of them being able to perform as promised in the proposal is a direct relationship to the percentage they want based on time. So if a CRO is coming back to me and saying, I need 50% of my budget based on time, that tells me that they actually have a 50% confidence level that they're actually going to be able to do the study when they said they were going to do it. And it's really kind of interesting to see their reaction when that comment is put to the CRO community. They usually don't have a really good answer for that, and they feel like they're being backed into a corner, but they're really just being backed into a corner they created themselves by virtue of the fact that they promised to do the study within a certain time frame. And if you take our way we do our milestone-based payment schedules, you put them against a cash flow analysis based on completing the study on time, it's actually a positive cash flow or at worst, a slightly negative cash flow for a certain period of time, but it really ends up putting them in a good cash flow position if the study is done on time. And that's what the whole purpose is for these performance-based milestone payments: get the study done on time.